It's there in your attendee kit just behind the schedule. And you can scan it as many number of times to keep giving feedback. If you have feedbacks on any session, you can keep giving us the feedback. And if there are any questions, there will be a menti.com. There will, when the panel discussion is on, you will keep seeing it flashing on the screen. You can scan the QR code and ask the questions, and the moderator will accommodate the question as per the time that it permits. So we're specifically delighted to have Tiny Miracles as a co-host this year. Tiny Miracles is transforming today's unequal system by connecting consumers, corporations, and NGOs in one side and extremely poor communities on the other side. And specifically on the session, direct cash transfers as a means of poverty elevation has gained a lot of attention in the last few decades. With the advancements in infrastructure, digital and otherwise, and increased access to bank accounts, there's an enhanced potential for designing and scaling direct cash transfers in unprecedented ways. Today, we'll have an amazing lineup of panelists to discuss the enablers to scale these interventions and talk about the possible innovations in this space. We have with us Atik Ji, Additional Chief Secretary Finance. He's currently overseeing the entire financial and treasury management of the government of Karnataka. Atik Ji is a seasoned IAS officer with over 32 years of career spanning various levels of government, including the Principal Secretary to the Chief Minister Office of Karnataka. And on the national stage, he has contributed as a director and also as a joint secretary in charge to the social sector in the Prime Minister's office. Thank you for joining us today, sir. We also have with us Murugan Vasudevan, the CEO of Vedas Foundation. Vedas invests in organizations working at the intersection of tech, policy, and social impact. Vedas also partners with government on policy implementation, effective public service delivery, and governance. And we also have with us Renana Jabwala from Seva. She's an Indian social worker based in Ahmedabad, known for organizing women into trade unions and addressing policy issues affecting poor women and informal economy. This panel will be moderated by Pankuri Shah, co-founder of Project Deep, the first and now the only organization in India implementing unconditional cash transfer programs. May I request the panelists to be on the dais, please. Before we move to the panel discussion, we have Shefali Bajpai, the Director of Impact Hub, to introduce a report that synthesizes what the Nudge Institute has learned from past interventions and research and set the stage up for this discussion. Over to you, Shefali.
Hello, everyone. It's a post-lunch session. So aware of what your state is going to be. I'm not going to take too much time standing between you and the panel. I happen to be on the same table with the panel, and I've already learned quite a bit, much more than what the report says to you. So I'm really glad that everybody's here for this session. At the Nudge, we continue to explore questions, solutions that can scale with meaningful impact. Direct cash transfers being simple in design, particularly given the advancements in digital infrastructure today in access to bank accounts, promises an intervention at scale. With evidence that's mounting up, particularly global evidence that's mounting up in the last decade or so, and about 1,000 research papers being published on 500 experiments across the globe, it is a very interesting topic to explore for the Nudge Institute. And over the last couple of months, we've been doing some research, and we've learned a few things that we wanted to share with every one of you, each one of you, for you to go. It's called Direct Cash Transfers, Evidence and Caveats. It's essentially a learning synthesis that we have accumulated over the last few months. We would request the panelists to, if they could just open the book and launch it, and the photographer to please come and take a photo moment for us. Yeah. Just a couple of minutes. I mean, just giving you a sneak peek into what we have studied. Um, One of the first few things that we realize is that there's a lot of philosophical debates around cash transfer. It's not just about the impact of the program, but the gaze with which the program is run, right? So, direct cash transfer proponents do not want to take a paternalistic lens towards poverty alleviation. They think that poor people know how to meet their needs the best, and therefore, if cash is given to them in sufficient amounts, they'll be able to solve their problems by themselves instead of we, the practitioners, deciding what's best for them. Uh, the other the other thing that comes up quite often is the substitution versus complementary design, in the sense that will direct cash transfers, when actually they're scaled, they'll require money, right? And where will this money come from? Will this substitute the current capital infrastructure investments, the current direct benefit transfers, or will it complement them? And that's a huge question for the panel today to answer. We are seeing that the design, I mean, we call it direct cash transfers as if it's one design. We're also seeing that there is a lot of variation within direct cash transfers as well. There is conditional cash transfers, unconditional cash transfers. There is universal versus restricted. There is also the idea of pure cash transfers, where you're just transferring cash and forgetting about it. But then there are blended modes by which you have layering of cash transfers over existing interventions. So it's pertinent for all of us who are interested in what cash transfers can do to actually go into the nuances, and these are some of the nuances that we presented in the report. And last, we've asked some important questions to which we did not get really answers in research. One of them is, while 3 years out in the program, we are able to see really good, great change, we don't really have a lot of evidence what happens in the long term, right? What happens when the first installment that you give to the poor gets exhausted? What we also do not know if what is the relative difference in impact when cash gets transferred to women versus cash getting transferred to men. I mean, there's a lot of intuitive feelings that I have, but we don't really have a lot of data on that, and it'll be interesting to explore that. We also do not know in communities where there is a lot of caste dynamics, right? Does direct cash transfer reduce it or amplify it? It becomes very pertinent in the case of India because we have a lot of data from other countries where caste is not particularly rampant. Another question that we have is, it's kind of a sub-question for caste, but where you have communities that are particularly excluded, communities that may not be able to, perhaps, taking again a paternalistic view, have the capacity, capability, or the exposure to make the best decisions for themselves, who need a little bit of hand-holding. Is cash adequate? And therefore, there's a lot of research that can be done in India. We are ready to do it, and we are excited about having these conversations. This is one of the conversations that will probably shed some light on the questions. So it's over to you, Pankuri. For the audience, there is a QR code that's displayed. If you want to download the report, you can just scan it. We have a few very limited copies in the interest of the environment. So if you can just download this copy and use it, it'll be great. But if you really, really need a hard copy, we'll have some displayed outside after the session. Thank you very much. Over to you, Pankuri.
Thank you. Thank you, Shefali, for laying the ground so well on really what is the need to have this conversation. I'll quickly just build up from there and speak to, why cash transfers and why this conversation now. I think, cash transfers is not a new idea. I mean, it's been around for a really long time, not just as an idea, but also in implementation. We've seen globally a lot of very successful and scaled programs, not just in developed countries like Alaska, but also in developing countries like Iran and Korea as well. But what we've seen is that pandemic really spurred this growth, right? When there was difficulties in making other kinds of aid reach people during the lockdowns, cash transfers really picked up again. The US has today, 150 programs running, which have come up post the pandemic. In our country as well, we're very privileged to have Renana Bain here, who has been one of the pioneers in actually implementing this in India back in 2011, even before we had, Aadhaar and all the infrastructure that we have today. But since then, now the governments have also picked up a lot of the schemes. We see 11 states in our country doing direct income transfers to women. And as much as we get shocked with the idea of unconditionality, how do we give the money without having any control? The governments are actually doing it at a large scale. And we have LK Atik sir here to shed some more light on, the government perspective, what are the building blocks required to actually make such things happen. And then, of course, we have Murugan, who has been working in the space of building state capacities and improving governance and, how schemes and welfare can be made more effective. For me personally, I think the entire movement towards cash transfers is what prompted me to enter this space as well. Like Shefali mentioned, it's the closest we can get to being non-paternalistic. To remove our perspective of development and really include the communities that we seek to serve and bring them into the solutioning. Project Deep is the organization that I work with, and in the last 2 years, we worked across 7 hamlets, transferred huge chunks of money, 65,000 per family across 264 families, and it's been very gratifying to see some of the results, to say that some of these things that we speak about, that the community is best placed and all they need is support, actually being validated. We see a lot of asset creation happening at the ground level. One of our core beliefs, and as you all may also agree, is that capital is what attracts more capital. And currently, the local economies that we serve are just cash starved. There is no space to focus on development, no space to focus on growth in an individual capacity. Of course, there are actors trying to promote that growth. And so that's the aim that we are working with, to say the question has moved past what happens when you give money, because there's enough evidence around that, but on how do you strengthen it? What's the good amount to give? What's a good timing to give? Like Shefali said, who do you give it to? What other support and care systems do you need? And how do you kind of maintain the balance with infrastructure and more other key essential programs? And that's what this conversation here is, to open up some of these questions to a wider audience, to bring more people into this conversation, into this movement with us. And of course, get some more insights from folks who have been practicing this at a large scale and for many years, more than we have seen. So with that, I will actually pose the first question to Renana Bin and request you to speak, shed a little bit more light around the different types of cash transfers. Why cash transfers? What is the reason to even speak about this and the benefits that you may have seen through your own programs and across the years?
Thank you, Pankari, and I'm really glad to see that cash transfers is again being discussed. We at Seva started looking at cash transfers as a possible way to overcome poverty way back in 2011, actually 2010. And the reason we did that was because for many years, we have been running our own bank, and we found that women, we only work with women, so I'm not talking about the difference between men and women, which was a question raised. But we have found that women use any cash that they have very very well, in the sense that they use it to advance their lives, their families' lives. They do savings, they make assets, and so on. So a lot of times we were spending a lot of energy trying to get other government programs to these women. And we thought, well, why can't it just be cash? And we ran across, now this was ages ago, as I said, 2010, 14 years ago. we got this argument that if you give poor people cash, they are going to drink it away and they're going to waste it and so on. And so we decided to do a study, and we did this study with UNICEF on actually giving people cash and seeing what happens. And at that time, I'm sure there have been other studies done, but at the time we did the study with about 15,000 individuals. There was a control group and a cash group, and it was in the rural areas in Madhya Pradesh. But before I get to that, I wanted to tell you that there are many types of cash transfers. And I'm just going to give you my opinion so that rather than just what are the different types. So you can have universal. You can have universal throughout or within a village or within a limited period, limited area. The second one is targeted. Now, you can have simple targets, and those are easy and good. So women is a target, but you can easily identify the target. Or you can have age. Pensions has been there for many, many years. So age is a target. But then there are some very complex targets, which the government of India and the states have been running, which is poverty. So then you have to identify who's poor, who's not poor, how much do they spend, what do they have, etc. And there are a lot of mistakes, which are so that you are leaving out a lot of people, and you're including a lot of people who are not within your target. So I would say if you have to target, make it as simple as possible. Make it age, gender, or like the farmer scheme, land, but there are issues there too. So targeting is one thing. The second thing is conditionality. And at least we are totally against conditionality, because what a conditionality is that, well, we give you money, but we think it's desirable behavior, and maybe desirable behavior, that your children should go to school. Or we give you money and you are pregnant and you should get all these checkups. The problem with conditionality is then you're dependent on somebody else. You're dependent on the principal of the school. You're dependent on the A&M to give you a certificate. And that's where all the bribing comes in. So I would say no conditionality. If it's targeting, make it simple. I know you said that people know that giving cash is a good thing, but we still hear arguments that if you give cash, they'll waste it, they won't know how to use it, or as you said, some marginal people don't know how to use the cash. I just want to tell you what our experience was. We did it with 15,000 people, and it was half and half, a control group and a non-control group, a cash group. And what we found were the following. Income, of course, went up because income was there. There was a lot, income went up by the amount you gave, but it also went up because a lot of them invested in assets. It was a poor rural area. It was universal within a certain number of villages. And people tended to invest in livestock and in things like sewing machines and in things like water pumps. So income went up way beyond what was being given. Their health-seeking behavior went up, which was very interesting, because when they didn't have money, they would wait till they were really ill before they went to the hospital. Here, they would go to the hospital much earlier, so that the amount that they spend was also much less. Girls' secondary education went up. And then there were a lot of other things, but there was no increase in alcohol, no increase in tobacco. So that big fear, they are going to drink it all away, and men and women were both given. So there was no increase in alcohol, no increase in tobacco. And one very good thing was that there was a very bad form of bonded labor there. And those people who were in bondage were able to pay off their bondage and come out. You raised a question about, does it help the caste? I don't know about that, but we found that there were some very rich families. It was universal. We are ready to give to the rich families. All the men said no. And then the women came to us and said, we want it. You don't give it to the men. But because they were very rich, but still the women had no empowerment whatsoever. And that time they didn't even have bank accounts. So, there was a class of women who were rich, who had lots of jewelry and everything, but who were still mixing with these women. Lastly, I want to say there was a question raised, what's the long-term impact? We only gave it for 1 year, but we went back and did a study in some of the villages 5 years later, and we found that about 70% of the people whose income had gone up due to assets still had a higher income. So their assets were intact, and they were in fact able to get, about 20% were able to actually get far more assets out of what they had. Others were keeping their income. Their health-seeking behavior still was better. The secondary school came down again, and the alcohol still didn't go up. So I think, even 5 years later, a 1-year cash transfer made a big impact. So I just wanted to, I think that's my time. I just wanted to give you very specific evidence about what happens when poor people get cash and when rich people also get cash.
No, thank you so much. I think that was very comprehensive. And no, I think we also still get the questions around do people actually know how to use it? And laziness, gambling, and alcohol are the most frequently asked questions. So thank you for covering that. And I think not just the SEVA experiment, the SEVA program, but also global research shows that substance use does not go up. And if you think about it, there is a linkage between living in stressful conditions and being attracted towards substance use. And if you're able to address the root of it, if you're able to provide some sort of economic stability and relieve the cognitive stress, the impact on substance use is likely to go down because you also are providing meaningful engagement. So thank you for covering that. And I think the point on universality as well, right? Because we speak about it in the context of poverty. Poverty is not an individual issue, right? It's a systemic issue. Being able to lift individuals out by providing money is not a thriving ecosystem. So I think being able to be as universal as possible is one of the ways to actually enhance the impacts of cash transfer. And I think at this point, I would like to bring LK Atik sir into the conversation because Karnataka has been also a front runner in one of the cash transfer schemes, Gruha Lakshmi in India, and it is almost universal in that sense, covering a large part of the Karnataka population. So would love to bring you in to understand, what is the why for the government, what brought back the conversation and brought the government in such a way, but also on what are some of the building blocks to be able to do it at this scale, to be able to actually reach this huge number of people and spend that huge budget. So over to you, sir.
Thank you, Pankoti. So Karnataka launched not just Gruha Lakshmi, but a slew of 5 schemes which the government called them as guarantees. So I'll straight away jump into as to why, and then we'll speak about how we have done it, and then raise a few issues of implications. And we have also done some quick surveys, etc., to find out as to whether these schemes are reaching and how they are being utilized. And we have spoken to people who have started conducting studies. Those will take some time. So the Congress government of Karnataka, when they campaigned during their campaign, they promised at various stages 5 different programs which they called guarantees. So the 5 programs are, one is the 2,000 rupees per month per woman head of household scheme, which they call Gruha Lakshmi. Then free power up to 200 units, it is called Gruha Jyoti. Then we have a program called Annabhagya, which is free food. So under the National Food Security Act, 5 kgs per person is already given and Karnataka makes it free. And in addition to that, 5 more kgs was promised. And the third one is free travel in public buses for women throughout the state. That is the fourth one. And the fifth one is you called Yuvanidhi. It is a stipend for graduates and diploma holders. It's 3,000 rupees per month and 1,500 rupees per month for a period of 2 years, 6 months after they graduate. And then the presumption there is that they would require that much time to find jobs. And during that period, when they are looking for job, they should be given some money. It's also a direct cash transfer so that that money can be utilized for training, for also sustaining while they are unemployed and looking for jobs. So these 5 schemes together have cost us 52,000 crores, and these schemes reach nearly 12 million people, 1.2 crores, and the free electricity scheme reaches almost 1.4 crore households. So coming back to Gruha Lakshmi, why these schemes were thought of? Of course, these were election promises, so we'll have to see as to what thought process went through in the party when they promised this. But the conversations that we have had is that one of the important key ingredient behind or key thought behind this was inflation. Because it was felt that particularly food and fuel inflation are affecting rural or affecting poor households and not so poor also. And particularly gas cylinder prices are going up, and therefore, so it was thought that if you can give 2,000 rupees to every woman head of the household, then that will compensate her for the effect of inflation. So this scheme that was one of the basic thought behind it. But of course, empowerment and poverty alleviation, and these are all these are all the other objectives that went through it. As to how it was done, the government was formed in Karnataka in May 2023, and the first cabinet meeting, they decided to operationalize all the 5 guarantees. And within 1 month, the first scheme, that Shakti free bus travel, was rolled out. And then approval for all the schemes was given in the month of June. And in a period of 3 months, we have rolled out the entire schemes directly into the bank accounts of 1.2 crore women head of the households. We were able to do this because we had a very robust public distribution system database. And in public distribution system database, we had already indicated, as per the National Food Security Act requirement, who is the woman head of the household. A lot of people feel that it is women-headed household. We are not giving it only to women-headed household. We are giving it to women head of household, and the choice to indicate who the women head of the household is left to the family. So there was some controversy in media, particularly led by the opposition, saying that will be given to daughter-in-law or mother-in-law, etc. But we have found that no such great controversy was there, because it was already designated. Most people had designated in the card as to who is the woman head of the household, and they had the bank accounts, they had the Aadhaar linking. Wherever there was deficiency in Aadhaar linking or the bank accounts were inactive, etc., wherever there was a payment failure, initially we had those teething troubles. But eventually, within 3 months, we were able to reach out to all the 1.22 crore women. And the conditions that we kept, the eligibility conditions we kept, were very simple. The entry bar is very low. Basically, anybody who is not an income tax payee or a GST payee would get it. And we found that income tax payee and GST payee, they overlap, because if you are a GST payee, you would also be an income tax payee. So, so we had that database from the income tax department, and we were able to do deduplication at the back end. So when we went in for enrollment, within an hour of enrollment is done, we would digitally print out a conditional acceptance and a sanction. And based on that, the sanction was given. So this is how the scheme was rolled out. We conducted a few surveys and we found that the reach was more than 90%. Most of the people that we went, we found that they did get the money. And how difficult it was to enroll, that also we found that it was not that difficult. And we basically did not use any government intermediary except to check at the back end. So therefore, it was we were able to roll out the entire scheme throughout. Karnataka has 7 crore population, 1.6 crore number of families. We were able to roll this out with hardly any intermediation, and therefore one of the biggest advantage of direct cash transfer is that we are able to distribute 50,000 crores of money with hardly any leakages. But if you try to do it through a scheme, there would be significant amount of leakages, and I don't hesitate to admit that. But in this particular fashion, the scheme, we were able to directly reach the people. So, and together with all the 5 guarantees, we have estimated that each family in Karnataka, each of the 1 crore 22 lakh families get about 4,000 to 5,000 rupees per month. That is the kind of income transfer, because if you divide 50,000 crores by a crore families, it is 50,000 rupees a year. That is the kind of income support that we are giving. In terms of budgetary allocation, because I'm the finance secretary, I must speak about what is the implication of this kind of a largesse of giving away $7 billion. That's what it means. Every year we are giving away $7 billion. I must admit that it is really hard, because it created a major fiscal impact on our budget, and it has impacted our capacity to spend on other sectors. And so that is it's a matter of concern. We have a concern that it might affect capital investment in the long run unless we increase the size of our budget. And so one of our the way forward for us is that we want to consolidate other schemes, try to minimize other schemes so that more money is, the money that we have put aside for guarantees will remain, but we will try to save elsewhere. That is one. And the other aspect is to try to increase your revenue mobilization and try to bring in private capital in infrastructure sector so that public investment actually goes into this. And we find that, actually our total size of Karnataka's expenditure is 3,71,000 crores, out of which 52,000 crores goes for the guarantees, which works out to be around 14%. 14% of our budget goes. And on Grihalakshmi alone, 7% of the budget goes. But one positive thing here, what we could see is that with 7% of the budget, nearly 67% of Karnataka's population is getting positively impacted because they are getting 24,000 rupees a year. So this is the kind of a scale that we have done, but I think this is the largest cash transfer that any state has done in the country, because only PM Kisan rivals the size, and PM Kisan is for the entire country. But for a single state, this perhaps is the largest. Other states have done it, but 50,000 crores, no other state does this much of money. So we find that when we have, our surveys have indicated that this has been positively received. This has been used for consumption needs. It has used to buy gas cylinders. It has also been used for health and education expenditure of children. There are anecdotal evidences where people have started investing in asset. Like there are some stories in media as to how a lady purchased a refrigerator. She never had a refrigerator. Because once you have a constant, regular, predictable income streams, then people can plan. They can take a loan. And if you further tie this up with NRLM or other self-help group activities, then we will be able to promote some amount of saving. Out of 2,000 rupees, maybe she can set aside 500 rupees. So these are the positive impacts that we anticipate. We are quite keen that research should be conducted in this. We are talking to several people. University College of London, one Professor Prabha Koteshwaran did conduct a quick survey already, and she found that it has reached people. But an interesting finding on communication she came up with was that she said that the people are receiving this, but most women don't know why they're receiving it. So this I thought was a counterintuitive to us. We thought it should be obvious, but we are told that it is necessary to communicate as to why people are getting it, number one. Number two, because of this very large expenditure that we are making and which is causing some stress on our other investment, there is a clamor in Karnataka to target it better, saying that why should everybody get it? Gruha Jyoti, which is free electricity, almost 90% of the households on average are getting. Rural households 100%, urban households 60 to 70% are getting, because 200 units of power is a very high bar. And most people don't use that much of energy. That's what we have realized. The average energy consumption in Karnataka is 53 units. So therefore, why should we spend? Why should the non-poor? Why should people who are living in an apartment, 3-bedroom or 2-bedroom apartment, also get it? These kind of questions are being asked. So this is something that discussion is going on. So we would be interested in finding out as to what it does to the agency of women. Is it true that it goes into women's account and she immediately hands it over to her husband and he will go and spend it on alcohol? We have also not found any evidence that it has gone into alcohol. I think 2-3% of the respondents said that it has gone into alcohol, but that's a very, very, very small proportion. So agency of women, as to how women's decision making is affected by this. Intra-household decision making of women with respect to money is something that we should study. And I think the most beautiful of the 5 schemes is the Shakti scheme, which gives free travel to women. And this has caused a lot of stories in the Instagram, a lot of memes where the lady just gets up and goes. And she doesn't have to ask her husband, her son, or her father, and doesn't have to ask anybody for money. And we found that the religious tourism has increased. The temples are flooded with visitors now, and then in fact the Rajya Sabha member Virendra Hegde Dharmadhikari wrote a letter to our chief minister saying that my hundi collections, he called hundi in Karnataka, collections have increased because of the number of people, women, and they also provide free food in the afternoon, Annadasoha. So, and he said that I have to now run a larger kitchen because of the number of women who are coming thanks to your scheme. So I think I have spoken, I have exceeded my time limits. I think if there are any questions, we can take. Thank you.
Yeah. No, I think thank you for being so candid. I think we're able to see a pretty end-to-end picture on like why it started and what it's being able to actually enable on ground. So that's very useful insight, because I don't think these are the things that we read in newspaper articles or reports. So thank you for sharing so candidly. And I think across what you spoke about, there are multiple things that you touched upon in terms of, a little bit of teething troubles or being able to figure out, correct bank accounts, being able to identify the citizen experience in terms of what are they actually using it on, or the communication gap. And I think traditionally there has been a space that civil society and philanthropy has played in sort of plugging some of these gaps, in also being able to experiment with what's there to build on it further. And so I'll bring in Murugan to kind of build on this conversation to say that in some ways, some sort of base is being laid in the space of cash transfers, but what next, and what do you see the role of philanthropy in building out what, the way forward in this?
Thanks, Makuri. Just a quick question though. Does anyone know how much total philanthropic capital in India per year is, roughly? Yeah, it's actually the amount that Atik sir and the government spends in a year in one state, which is a big state, large state. But, so I think we always see at various foundations, there are family foundations who are both an implementing organization as well as a funding organization. And so on both sides, we see that, and the government spends about 30 to 40 times on welfare, as much as all of philanthropy combined, even if you assume all of philanthropy goes towards good welfare causes. And not, other religious causes and so on, which is included in that number, right? So given that it is such a small percent, the best way for philanthropy that we strongly believe is to accelerate, enable the work of the government. So all of our work is in terms of helping states build capacity, or to help build evidence of policies, to help on, Atik sir again talked about how do you find money on, so a couple of states we are working with revenue augmentation. One of our portfolio organizations, CGIS, is working on that. And I think that's really where, our sense is on philanthropy in general and working with the government. And if we see more and more state governments doing direct cash transfer, then I think, the right role of philanthropy again becomes, a couple of different ways there. One is, there is a debate, development and growth, and we were talking about it earlier. The anecdote from the temple actually proves it out, is some of these things are actually straddling both the development and the economic growth, right? It's not just direct 50,000 crores goes towards welfare, which is in some ways seen as a bad word by one or the other political party. But what percentage of that money actually gets amplified and comes back to the exchequer by way of additional spends, GDP growth, asset creation, and so on? If someone is actually buying a refrigerator, knowing that there is 2,000 rupees coming every month into her account, that's actually driving economic growth in some sense. Hasn't been enough studies done to help governments actually think about what is the economic growth impact of a development program, in a welfare program. I think that possibly is an area where research can a little bit more done, and that is a natural home for philanthropy to fund, because again working with the government. The other thing, of course, on the same development versus growth is 24,000 split over 12 installments versus 24,000 upfront, right? How would that change the household in terms of how they think about, okay, now I have 24,000 rupees, okay, what will I do now? Will I still go buy that fridge, or will I say, okay, let me put 10,000 in a fixed deposit and then do something else with the 14,000? We don't know what we don't know there, right? I think those are some really interesting things that we have a lot of room for experimentation. And many of today's very successful national missions like Manrega or DNRLM or PM Kisan were actually experiments done by states, right? That became national programs. So I think there again is another role for philanthropy to play, is how do you create more spaces for experimentation working with the government. And I think that we are very clear about that. Is I think if you really don't work with the government, then there are very successful models, of course, who don't work with the government, but I think the path of least resistance is possibly working with the government. So I think that's thing. And just on a point, when Ranabin talked about conditionality, I thought I'd ask this question. Many of you are from non-profit organizations, receiving funds. Would you prefer an unrestricted fund or a programmatic fund? So that's what it is, right, in terms of conditionality, right? Because you will do better work with an unrestricted fund versus someone who says, thou shalt go to 262 schools and serve 5,200 people and buy 22,000 pencils. So I think, that's the way, I think more and more philanthropy has to really think around their overall portfolio in terms of unrestricted. And I think this program lends itself well to think about it in a programmatic way, right? So,
yeah. No, thank you for sharing. I think one of the questions that's from the audience is also on the last point that you mentioned about just some of the conditionality that becomes inherent because of the other players in the system, which could be regulatory bodies or funders and auditors. And we need more folks like you who believe in that unconditional element. I think the question was posed for you as well, you and me, Rananaben, to say, how do we deal with the external agencies that question the unconditional element? So just a quick point from me to say is that there are two ways to look at it. One is that there is enough research. So for those who are on the head and logic side of things, there's enough research to showcase the benefits of unconditionality that I think everyone's spoken about. And then there are also, of course, enough stories and like the question that Murugan posed to really appeal to your individual experience to speak about how unconditionality matters. We're nowhere close to being extremely evolved in this space, but I think the journey has started and we are seeing it positively move forward. But I'll let Renana Ben speak to how do you perceive or what do you think are good ways to engage with external folks like regulatory bodies, like funders who may question the lack of control that comes with the unconditional element. So the government, of course, has the space to put out schemes because they have, a larger resource, larger sort of space to do that. But to what Murugan said in the space of experimentation, how does experimentation grow with certain constraints?
Actually, you brought in a totally new element of the NGOs from going from people to NGOs. I actually, should we shift to NGOs or do you want to remain with people? I know, but does it come from an NGO question? I mean, are you asking about philanthropy, or are you asking about schemes which reach people? That's because the two are very different. There's no regulatory body to ask a low-income house or any income house, what did you do with your 2,000 rupees?
I think the question is to NGOs because the idea of distributing free money, like it's called, is quite problematic for non-governmental actors. So I think that's where the question.
Okay, so we sort of shifted to NGO. Okay. I've been working for many, many decades with philanthropy. And earlier, the philanthropists who gave you funds came and saw your work and either believed what you were doing was right or didn't believe what you were doing was right. Today, you have all the McKinseys who've come into philanthropy. The people from business who've come into philanthropy and then who are sort of compare it to business and say, well, I have spent 10,000 rupees on this NGO, please tell me exactly what impact this 10,000 rupees have. And then they ask that now you should have a mail. And you spend on a mail and you find a person who will do your mail. So I think the idea of philanthropy has shifted to making it into a business. And that actually people who are working in non-governmental organizations are doing it out of some form of commitment. So you drop that commitment and you become part of the business and you become part of the way in which the business is conducted. So I don't think it's a very good thing. You either believe what this organization is doing is good or it's not good. That's
No, thank you. I think it's not an easy question to answer. We've had a few questions from the audience on how cash compares against other programs like graduation. What are some of the, I think this is, so, but we don't, in the interest of time, I'm actually going to request folks to come up individually after the session for some of specific questions, but I'll do one last round to speak about what Murugan started as the role of philanthropy, but to hear from Renana Ben and Atiq sir also on what are some of the roles that other actors can play in this space. What are some of the thoughts on innovating this? I think in our earlier conversation, we were speaking about how some schemes have the possibility of consolidation, like, for example, the electricity scheme that Atiq sir mentioned, whereas something like a bus travel, if subsumed, has almost negative implications because it affects the agency. So a few questions on the way forward. What are the roles of other stakeholders? What are some of the parameters that should be kept in mind as we think about the scale of cash transfers to, say, balance with infrastructure and other welfare spends? And any particular thoughts on what are we're looking at poverty alleviation, but there are different ways to measure that. So what are some of the outcomes that, what are some of the common language around outcomes that we can develop to understand and evaluate whether these schemes are actually impactful on the ground? So these are to all three, and you can answer it in any order, but I'll pass.
In terms of policy, I think what I would look at, should this kind of large-scale cash transfer become a policy? And in that, what should be the other aspects of policy? How other stakeholders should get involved? I presume that's your question. So one issue that I hinted during when I was speaking was about the fiscal sustainability of large-scale cash transfers of the kind that Karnataka does, and also the kind that many states are doing this now. Even union government is also thinking in terms of this. So I find that the fiscal sustainability of cash transfers is a serious issue that one has to consider. And therefore, this near universal cash transfers that Karnataka has ended up doing has to be thought through. It has to be evaluated again, I think. Because one of the justifications for cash transfers, I mentioned a few. One thing that I forgot to mention is that the the trickle-down theory actually doesn't really work. So, and the income inequalities are growing and they are worsening. In the natural flow of a capitalist economy, what happens is that the people who are rich will get richer and the poor may not get poorer, but they don't grow at the same pace as the rich do. And therefore, we will have to do some amount of redistribution, and the kind of cash transfers that Karnataka does is an exercise in redistribution. But this should at the same time look at some amount of targeting, because a lot of clamor in Karnataka today, this mass media is questioning this government as to why are non-poor, why are relatively well-off people getting this kind of money. And particularly when we are faced with a situation where perhaps we may be constrained in investing in building in schools, roads, hospitals, and maintaining public service infrastructure. Because now capital investment in providing public services like school, health, education, sanitation, roads, public health, etc. And these, we cannot starve these two sectors also of money. And when the resources have a competing demands, we may have to look at, therefore I think we need to look at better targeting. We perhaps also need to look at consolidating some of these schemes. That free power is a major intervention and interference in the way market works, and then that creates a lot of other incentive problems. If there are, if I am able, I was using 100 units, and it's free up to 200 units, I might try to increase my consumption unnecessarily and without paying for it. And the government will have to pay for it. And if government does not pay the electricity companies regularly, then we'll have a problem. Even our Shakti scheme that we are doing, we are supposed to pay the road transport corporations. And how do we pay for this one? And because it's very difficult to account as to how many women passengers have traveled. And so, and if we don't pay the transport companies, and they might start deteriorating, their capacity to make reinvestment, buying new buses will also get affected. So a lot of pros and cons will have to be examined in terms of to larger point of sustainability. You asked a question about other stakeholders. I thought I'll use the opportunity to bring in the issue of sustainability a little more. As to I strongly believe that if cash transfers, unconditional cash transfers, because ours are unconditional cash transfers are a way to go. But I think we need to look at fiscal sustainability. We need to target them better. And we need to link it with other, like for example, we have NRLM, we are working with self-help groups, etc. And this steady stream of income flows is a very good mechanism to really tie up savings among women self-help groups. And that can create entrepreneurship, that can create jobs, And so there are many positive spin-off that we can do by using other building blocks.
No, we're coming to an end almost, and Renana Ben will probably close it better than me. But I'll just say that in addition to financial sustainability, what the Andhra elections have proven that it may not even be politically viable, because Andhra transferred 2.5 lakh crores, if I'm not wrong, in the previous um, dispensation. But one of the things that did not happen was the economic growth that was what people expected. People had a lot of cash in their hands, but there wasn't, economic growth that went along with it. So these are things that need to be thought through holistically. And it's, and one other point on terminology also, right? And this is where I was hinted at earlier. Is it cash transfer or is it an investment, right? In someone or a family, and that's, those things also might start help, people look at it differently. Back to Tixer's point about communication and how do you package it. It's actually an investment. If an investor transfers money into a founder, it's an investment. It's not a cash transfer, right? It could go down to zero. So I think there's some things we have to think about, and there are lots of rooms for, there's a lot of room for philanthropy, civil society to work closely with the government on all of this. So I'll leave it at that.
Shall I just just to wind up what was just said, and I also think that what are the alternative things, what are the other things that need to go along with the cash transfers to convert it, exactly what you said, into growth and removal and coming out of poverty, rather than looking at it only as cash transfers. And there are a few things here, and again, you would really need some good impact studies for that. One of the things we found is that people do invest in assets, which then lead to, and when I say assets, some are consumer assets, but I meant productive assets. So, and especially in the rural areas, they do invest in assets. So what are the things that we can do to increase that investment in assets, whether it's livestock or farming or non-farm type of things? So that's one issue, and I think it requires a kind of study so that you can go do the communications. And the second thing is what you mentioned, which is, again, I have many decades, and I'm seeing that people's savings is going down. In earlier years, savings was always a very important way of looking at your future. Today, savings is not that important. But so even in, I think if you look at the macro, the savings from individuals has gone down quite a lot. So what kind of communication, what kind of schemes, etc., should we have? And mostly, middle class families are not saving in banks. They're now saving more in mutual funds and so on. So what kind of savings should we be promoting at that rural area, at the lower income, so that the savings go up? And the savings of the country go up, which of course leads to more economic growth. So I think these two things, productive assets and savings, how do you link it with cash transfer without making it conditional?
Thank you so much. It's been a fantastic conversation. And just to sum up, I think that there is some amount of consensus on the fact that cash transfers work and the amount of work that's going to be required to really understand the nuances of what worked means. How can we contextualize it? What is the amount? How can it lead to asset creation? How can it lead to capital formation? In our smaller pilots, in our own work, we've seen a huge amount of capital formation on the ground. We've seen income increases and similar things to what Renana Ben mentioned. So I think the open questions remain, and that's actually an invitation for folks to come in and help us answer those. I'll quickly end with a quote that motivated at least me to enter the space, to say that poverty is not a lack of character, it's a lack of cash. And so how can we actually kind of let go of these biases and trust issues that hold us back from entering this space? Thank you so much to the panel, and I'll hand over to Gayatri again. Thank you.
Thank you very much. I think that was exactly what I wanted to sum up as well, because across the Charcha, a lot of myths get broken in terms of inclusivity, especially in people that are not like us, right? We always fall into PLU fallacy, we call it, people like us fallacy, and then the otherization happened that as soon as you give money, they are going to do this, they are going to do that. I think those myths with data has been proven very differently. I think this is the best part of it, that we continue these dialogues and conversation. I'm going to just ask Shefali to honor the panelist for being there. We have this QR code that you are seeing there. If you can just scan the QR code, you will get the soft copy of the direct cash transfer evidence and caveats book. While we prefer to have you all do around 20 to 30 books are available with our volunteers outside. If somebody prefers the smell of new books, you can just go and pick one for yourself. And the next session here will be at 3:20, and the session at Silver Oak will be Powering Together, Shaping Systems and Approaches to Work for Communities by Communities. And let's meet here at 3:20.